Good morning, everyone. This is Jackie Linton from the School for Health and Care Radicals. And I'd like to give a really warm welcome to everybody. It's great to see so many people joining the call this morning. And I'd like to give a big welcome here from England, and lots of people joining right across the world. So that's great to see. We've now got over 1,300 people who've registered for the school, and we're just really delighted to see so many people have joined this morning on our second module, Forming Communities, Building Alliances for Change. So we've got a really exciting webinar in store. We're hoping for lots of chat today, lots of interaction, and we're ready to go. So just to remind us of where the School for Health and Care Radical fits with NHS Change Day, our grassroots social movement, which is all about what we can do in terms of our own individual commitments and actions to make a change and to make a difference for the people who use our services or for health and social care. So I'm going to hand you over to Helen Bevan very shortly, but I just wanted to remind you, as you go through the module, just to be thinking about, are there any pledges that you can think about or that you'd like to commit to, so that you can put them straight onto the website in our School for Health and Care Radicals campaign. But I'll come back to you. I'll come back to that right at the end of the session. But I just wanted to remind you to be thinking about that. So we're going to get straight in now to our webinar for the day, which is Forming Communities, Building Alliances for Change.
Good morning, this is Helen Bevan, and I'm going to be leading you through most of the module this morning. So, I think one of the great things about the last module was just what a sense of community we were building, and so many people contributing, and I think the chat box was actually as interesting, or maybe even more interesting, as the content. Just the whole way in which so many people were contributing with resources, supporting each other, and we really want to keep that spirit going, and for all the modules of the school. So please continue to use the chat box in the bottom right-hand side of the screen to contribute continuously during this web seminar today. I know that many of you are very good at multitasking, and we've got some great tweeting conversation going on Twitter. And again, we'd like you to keep tweeting during this session, if you can, using the hashtag NHS Change Day and School for Health or SHCR chat. What we'll do is, at the end of the session today, we'll produce a discussion using Storify and Pinterest. All those will go onto the website, and we'll send you the links in our newsletter this afternoon. And please carry on with the chat beyond the seminar on our live web chat forum on the website. So yeah, really looking forward to your contribution today. What we'll do a couple of times during the web seminar this morning is that we will stop and we will get a summary of what's been happening both in the chat box and on Twitter. So I'll just, at this point, I'll just introduce the people who are going to be leading that process of synthesizing today. So Pip is going to be helping us in terms of synthesizing chat. So let's just hear Pip loud and clear. Good morning, Pip.
Hello, everybody. Hello, Helen. It's lovely to be here.
And in terms of Twitter, Jenny is going to be looking after things. So good morning, Jenny.
Morning, Helen. Morning, everybody else. Looking forward to hearing lots of your tweets and then seeking some insights from them this morning.
Fantastic. So, as we said, there are 5 modules in the school, and our module today is about forming communities and building alliances for change, which are key skills for change agents. Just before we get going on the content, some of the headlines since our last module. I can't believe that it was only a week ago. The number of learners taking part continues to grow exponentially. We put the slides from Module 1 on SlideShare, and they've had more than 3,000 visits. In terms of the Twitter chat, we've had over 1,500 tweets, 395 different people tweeting as part of the School for Health and Care Radicals, and our potential reach, which is the extent to which our tweets about the school have gone to other people, is 2.6 million, which I think is really great reach in a week. And we've got 90 volunteer mentors, and Liz, who we're going to hear from shortly, has been busy matching learners and mentors, and that process seems to be going really well. What I've also got here is a word cloud representation from the chat from Module 1, and these are the words that were being used most constantly in the chat in the previous module, and I think these are really nice words. I mean, what I thought about this is there's so much kind of energy and positivity and kind of hope and possibility around these words. So yeah, they make me feel very hopeful. So quickly moving on in terms of what we're going to cover in our session this morning. So first of all, just want to connect back to Module 1 and how the topic in Module 1 fits with our topic in Module 2. Our second topic is why, as health and care radicals, we can't do this on our own. A key skill for us is about how we build alliances with others and communities for change. We want to think about what we might learn as health and care radicals from the leaders of some of the great social movements, because these were leaders who typically had no resources in a formal sense, who didn't have hierarchical power, and yet were able to take action that changed the world. A key aspect that many of the great social movement leaders utilised was about framing messages to connect with hearts and minds. So we want to cover a little bit of work about framing and telling our stories. We're going to talk about bridging disconnected groups and how we build community for change with people who wouldn't necessarily be connected. And we want to talk about building our own community. One of the things we're going to do a little bit differently this time is we've actually got a panel of colleagues from the School for Health and Care Radicals who have been building communities since last week. And actually, a couple of times during this session, we're going to stop, and Liz is going to facilitate some discussion with some of the members of the school. So I'll just check that Liz is there. Liz, can we hear you loud and clear?
Good morning, Helen. Good morning, everybody. Yes, I'm here.
Yeah, look forward to hearing you shortly, Liz. Then at the very end, we're going to have our questions and call to action, and again, Pip, as our learning lead, is going to come back and get us in reflective mode right at the end of our session. So let's do some bridging between Module 1 and Module 2. So the big theme last week in Module 1 was about change starts with me, and we particularly talked about self-efficacy and our self-belief that we can make a difference. And we found this really great TED talk by Barry Posner, and it was called The Truth About Leadership. And there were two big themes in this talk. First of all, you can make a difference, being self-efficacious as a leader or agent of change, and you can't do it alone. You've got to build community and alliances with other people. So we actually thought that was a very nice theme, if you like, to make the transition from Module 1 into Module 2. So, as we do that, if you like, as we make that transition, just thinking about metaphor, how does it feel to be a health and care radical sometimes? And we found this image. We're in a field of flowers that all seem to kind of think in a certain way, and I'm different, and what do I do? And then something else that I thought was really lovely was we had the tweet chat on Wednesday afternoon where a whole number of you came to take part in a conversation about the learning from Module 1. And there were a couple of particular tweets that I think really kind of caught the spirit of Module 2. So the first one was from Anne-Marie Tesora, and Anne-Marie was talking about how she felt sometimes as a change agent. She said, sometimes I feel like I am a visitor from the future, frustrated by the slowness of change. And I think a lot of us feel like that. And then Julian Stoss, his response was, you know, this is about small steps on a big journey. You know, you are the vanguard. Create stories of the change to amplify it. And that, I don't know, that just felt like that Twitter conversation felt like a really lovely transition and wise words from Module 1 to Module 2. So, you know, it is very easy to feel alone and isolated, and we've got to be able to build community and build alliances with other people from change. And Julian's right, story is one of the most powerful ways of doing that. So last week, this is one of the slides that we used, and we talked about the emerging themes in change and transformation, and if you like, the dominant approach and the emerging direction, which creates all sorts of opportunities for us as agents of change. And one of the key ones was about making the move from organisation at the top here to community. Okay, that in a sense the dominant approach is one that's about hierarchy, it's about power through position and authority, and the one that we're seeking to move to is about building power through community. So let's talk a little bit about community. So first of all, you know, what is community? And you know, if we kind of look at the kind of evidence base around community, I mean, basically we see community being talked about in three different ways. Okay. Community can be a locality, so, you know, a particular place, a community of a particular village or town or place. Community can also be about a shared interest or a shared purpose, and people come together as a community, you know, a community of learners, a community of activists. And the third sense of community that we read about is about community, almost like a sense of belonging. You know, we talk about community spirit, the values, the sense of purpose, the sense of justice, the thing that we're trying to achieve, what binds us. Okay, and again, you know, I'm just thinking about when we talk about the Second World War in Britain, and we talk about, you know, the community spirit that happens in times of distress and disaster. And just put this quote there from Margaret Wheatley: "There's no power for change greater than a community discovering what it cares about." And what I wanted to do was, you know, when we were like looking at the slide that's about the kind of the dominant situation and the emerging direction, community in that context. And I chose this quote from Nilofer Merchant, and you know, she said, "Power used to come largely through and from big institutions. So in a sense, the bigger size you had, the bigger clout that you had. But it's changing, because today power can and does come from connected individuals in community, when people come together with a common cause, a common interest. And when a community invests in ideas, it co-owns the success of them. So as health and care radicals, as change agents, instead of trying to achieve scale all by ourselves, we have a new way to have scale. We build scale for change, okay? Scale to make a difference. With and through community. And again, when I think, for instance, about NHS Change Day, and I think about the people that made the 189,000 pledges last year, and I think about the people who've already made more than 50,000 pledges this year, and we've still got a month to go, that's community. You know, that's this kind of scale that we're talking about, people who choose to be part of that movement. And again, you know, going back to last week and making a connection with it, and we talked about what makes a successful boat rocker, and change begins with me, and we identified 5 things about successful boat rockers. And number 3 was about being able to join forces with others to create action. That's really what today is all about. I do like this quote from Seth Godin, and he says, the easiest way to thrive as an outlier is to avoid being one. And I think that's really wise. So, you know, sometimes when we feel like we're the white tulip in the middle of the field of pink tulips, you know, it feels a very lonely and isolated place. It makes us feel like an outlier. So in a sense, what we have to do is to find other people to be in our community, other people who share the same goals and the same interests and have got the same vision that we're trying to create in terms of a future. So in a sense, we're not an outlier anymore, we're not isolated anymore because we've built community with other people who think like we do. And again, going back to this African proverb that Pip used last week, if we want to go fast, then we can go alone, we can make things happen. But actually, if we want to go far, if we've got really big ambitions for our patients, our service users, and our workforce, then we need to go together. So, you know, when it comes to kind of building community, and not just community for the sake of community, but community because actually we want to make a difference and change the world as health and care radicals, who can we learn from? And like we said last time, is that we have been learning for many years from social movement leaders. And this was actually a little book that myself and Liz helped to co-author that was called The Power of One, The Power of Many, bringing social movement thinking to health and healthcare improvement. And we published this in about 2005, 8 years ago, but I think there's some really wonderful learning from this. And what we're going to do is we'll put the PDF of this you know, onto the website. But, you know, a real sense that we can learn greatly from social movement thinkers. And it's interesting, you know, when we look at many of the kind of initiatives and campaigns that are happening currently or have happened recently that are trying to get better outcomes and experiences for our patients and our service users, we see many examples of using social movement, call to action kind of ideas in our work. So we've got here the Dementia Action Alliance, the Right Care, creating dementia-friendly hospitals, because, you know, given that around 20% of people that are in a hospital bed have got dementia, actually creating dementia-friendly hospitals is really, really important. Okay, health promotion, you know, 5 a day, the Manchester way, we really like that. The work that NHS England is doing at the moment in terms of its call to action to the people of England about where we need to go next with the NHS. And so on and so on. So we can see, you know, how these ideas are starting to have an impact and to influence. And, you know, if we look at effective social movements, if we think about the social movements that really made a difference, and when I think back, you know, to the women's suffrage movement or the American civil rights movement or the environmental campaigners of the 1970s who were so successful in what they did. You know, what do we see time and time again in people and groups within effective social movements? And, you know, what are some of the learnings that we should take? And these are some of the characteristics that we see time and time again. In a sense, you know, these communities coming together. What is effective about these communities? First of all, they have a sense of purpose. So in our collaboration, in our coming together, we understand, you know, why we are trying to do this. So a very, very big focus on why, not just on what and how, but a real understanding of what we're trying to achieve together. The second thing is they're united. And, you know, when we look at the most successful social movements, they were able to bring people together with a very wide range of interests and backgrounds and expectation. And often, you know, very, very big differences. But the thing about the great social movement leaders is that they were able to bring people together despite difference, okay? So that we know we can come together and be united to accomplish the purpose that we come together for. Thirdly, there's this issue about understanding. And it's not just we agree with this cause, but we understand what we're trying to do, what the challenges are, and why the things that need to be done, and we'll come back to that shortly. The next thing that happens is lots and lots of people participate. Lots of people are active, not just active in talking, but active in making the change happen. Okay. The next thing is that these people and groups take initiative, so they don't just wait for permission, or don't just wait for the boss to tell them what to do, or the leader. Okay, they react to whatever's happening. They're proactive. They're getting on with it. And finally, they act. They're activists. They make things happen. So it seems to me that's a pretty good list of the characteristics of the kind of people and groups that we want to be connected with as health and care radicals. What I want to do now is I want to hand over to Liz. And like I say, Liz was very involved or has been involved for many years around the work around bringing social movement ideas into health and care improvement. So what I wanted to do was to ask Liz to give her perspective about social movements, and then she's going to lead a discussion with some of the members of the school about the kind of implications of this for building communities for health and care radicals. So Liz, over to you.
Thank you very much, Helen. Good morning. I do have the next slide. So first of all, I'm going to put my panellists on standby because I'm going to be calling you all in shortly, and thank you very much for helping today. And also, please do use the chat. I'm going to be asking some questions that I'd like other people to contribute to. So what we've got here, to build on what Helen's been saying, is a definition of what a social movement is. And I just want to pick some of the elements out of this. So it's a voluntary collective of individuals committed to promoting or resisting change through coordinated activity to produce a lasting and self-generating effect, and creating as they do a sense of shared identity. And this very much builds on some of the comments that Helen made earlier around communities and how communities form. But the two elements of this that I really want to focus on at the moment is, first of all, the voluntary collective piece. So it's about people who are like-minded, and this is the way that we're enabled to overcome this sense of isolation that Helen referred to earlier. So it's people who are committed to each other. And then the next element that's really important is the coordinated activity. So it's not just about random acts and people, people didn't just randomly turn up in Washington that day. There was a massive machinery behind the march into Washington to support Dr. King. So it's a community that's designed for a purpose. And what I've been doing is looking through all of the chats and the Twitter and all of the various comments that we've had since last week to look at how these communities are starting to form with all of you. And I'd really like you to start using the chat now and tell us what have you been doing since last week. But I'm going to pick a few things out from this. So we saw on Twitter, Dorset and Wessex set themselves up last Friday, West Midlands, the Hertfordshire Radicals, and meanwhile on the chat feed last week, the South West were all connecting, East Berkshire Learning and Support Group, the North West. So there were two very key things for me that I could see. I could see people connecting by interest and profession, but also I could see people connecting by their locality. Excuse me, sorry, I just caught that slide again. Let me just go back to where we were. Okay, so I saw people connecting by locality as well. And if we go back to what Helen was saying around communities, she picked those three elements out. So there's locality, interest and purpose, and sense of belonging. So if you start putting your comments, particularly for those of you who've tried to connect via interest, because the locality ones were very obvious to all of us, but we'd be really keen to see if you have started to connect either by interest. I saw some change makers trying to connect. So let us know what's been happening. So if we look at the localities, I'm going to call my panellists in. We've got Sue from the West Midlands, we've got Carol from Salisbury, and we've got Jodie. I think Jodie's from the South West as well. We've got Kirsty also, who's desperate to join us. Kirsty's on leave at the moment. She's on maternity leave, and she's in her home with her baby. She's trying to join us, but her microphone's failed, so she's going to put her comments in the chat for everybody. And they're going to answer this one question. Why did you feel it mattered to you to form as a group and come together? And I'm going to put Sue to come in first with Carol on standby afterwards. So Sue, if you could unmute and give us some thoughts about why you felt it mattered to form as a group and come together.
Can you hear me? Hello?
We can hear you
loud and clear.
Can you hear me, everybody?
Sue, we can hear you loud and clear. You know that you can be heard because you'll see little lines coming out of your telephone handset on the screen, which shows that your voice is coming through.
Okay, thanks. I mean, for me, it was really great, and I just want to say thank you to Jenny Price, because we're lucky enough to have Jenny working with us in the West Midlands, and she's been really instrumental in supporting me in getting this movement going on. I think we've tackled this on two levels. We've got a West Midlands-wide interest, but within the organisation we work in, Jenny and I were noticing that there were individuals who we felt were like us, who were feeling that they didn't fit, they were feeling isolated, they wanted to make change but didn't know how to, or were getting resistance. And we felt that this just came at the right time and was something that we could sort of hang on to. And I think the fact that people found they had a name for how they were feeling really made them feel that they had some community or belonging. So for us, it was just a no-brainer, actually.
Thank you very much indeed, Sue. And we'll pick up some of the other elements of that quote, particularly this element about coordinated activity later on in the call. So, Carol, I'm going to call you in now and put Jodie on standby. So, Carol, are you ready to speak? Okay, we're not getting Carol. So, Jodie.
Hi, Liz. Can you hear me?
Okay, Carol, we've got you. Okay, Carol, we've got really poor sound. Carol, if you stay on mute because your sound's very poor. Okay, Jodie, I'll call you and thank you.
Hi, Liz. Can you hear me okay?
Yeah, we can hear you, Jodie.
Hi there. For me, the reason I wanted to try to pull together some fellow radicals, fellow change makers, is, I suppose, geographical isolation for us down in the southwest. And I know there's lots of us around on Twitter, but getting the chance to meet face to face for me is really important. You know, we all know that energy that we feel when we go to conferences and expos. And I kind of wanted to recreate that on a local level. It's interesting because we've actually had a few of us that have been talking about doing something like this for some time, and Carol is one of those people. But just reflecting back on one of the previous slides about the characteristics of an effective social movement, perhaps we felt we didn't quite have that purpose. And I feel this School for Health and Care Radicals is given us a much clearer purpose and focus as to where we want to take it. So, you know, we're quite small, we're still fledgling, but we're still looking for people to come on board and join us.
That's great. Thank you very much, Jodie. And what's really interesting to me about all of this is community is where we are, it's where we live, and that's a really critical bit, which is probably why the locality groups are forming so fast. Because obviously, you know, it's what matters to us. You know, my local hospital is what matters to me, and if I was going to campaign for anything locally, that would be it. So I'm going to move on now back to Helen to take us into the next bit of the talk. Thank you to my panellists, and we'll be speaking again towards the end of the call to build on these ideas around coordinated activity and what we're actually doing, how we're actually going to bring about change and make this really fly.
Hi, I'm back. Hi Liz, thank you for that. I think that was, and thank you panellists for that as well. I think it's really helpful in terms of bringing, you know, some of the principles and ideas alive, and I hope that it's inspiring lots of other people as well to want to build community and connect around the School for Health and Care Radicals. So, you know, just thinking about some of these ideas that we take from social movement leaders and community organisers. I think one framework that I find very helpful is this one from Marshall Gans, and he says if we actually want to create change at scale, then we need to think about two different things. We need to think very purposefully about our strategy for change. You know, what do we actually need to do? What do our tactics need to be? And we also need to think about narrative and story. And, you know, we need to connect both with the head and the heart. And it's a combination of the two that gives us a shared understanding, both at a logical, rational level and at an emotional level, that leads to the hands and leads to action. And, you know, I was taught very classic approaches to strategy because I did a business education. And actually I learned from Marshall Gans and from the community organising movement a very different approach to what strategy means. And he defines strategy as the process of turning the resources that we have got and that are available to us into the power we need to win the change we want. And to me, you know, this kind of makes the point about why getting organised and why collaborating with other people is such an important part of change. Because, you know, what resources are available to us? Okay, we may not have formal hierarchical resources, but we have other resources. And how can we use those resources to turn that into power? The power of the movement, the power of community, to win the change we want. But where we're talking here about resources in a social movement sense is quite different to the way that typically in health and care we would think about resources. So typically, when we think about resources for health and care, we think about economic resources. And the thing about economic resources is that they are finite. You know, there is a certain amount available, and they diminish with use. So we're talking about, you know, money that's available to pay for project posts or to second me for so many days a week, materials, technology, and so on. Okay. But economic resources are very different from the kind of natural resources that we will use when it comes to building alliances and movements for change. And the kind of resources we're talking about here are what we're calling natural resources. And the thing about these resources is the more that we use them, the more that they grow. And these are resources that are around the relationships that we can build with other people, the commitment that we can make through those relationships to a different future, a commitment to take action because we've all got the same goal. And this community, you know, very much becomes part of these natural resources. And like when I think, for instance, here about the School for Health and Care Radicals, 90 people have volunteered to be mentors, to support other learners. And I think that is a fantastic example of the natural resources that will grow the more that we use them. So, you know, if we want to identify these natural resources and grow them with use, then in a sense we've got to be able to, as health and care radicals, to put our messages across in ways that will attract people to be part of our movement, to be part of our community, and want to be, to play their role in it. And if we look at the social movement literature, we talk about this in the context of framing. And this comes from Snow and Benford, who are very well-known researchers in the field of social movement leadership. And they describe framing as the process by which a leader creates and puts across, articulates a message, and specifically does it in a way that is powerful and compelling, and as a result wins people to our calls and calls them to action. So it seems to me that framing is a very important skill for health and care radicals. So I just kind of put an example here about framing maybe in our context. And, you know, here's a group of people who are passionate about a cause. You know, they're part of a social movement, and they're not just kind of sitting around talking about it. You know, they're taking action. And I think it's interesting to kind of maybe frame that with some of the things that we see in our lives. So, you know, what's the financial incentive for doing it? Who's performance managing it? You know, what's the project plan? And just to make that even more real for our world, this was a very interesting piece of research by Keller and Aiken, who are actually researchers from McKinsey. and a very nice paper they wrote, The Inconvenient Truth About Change Management. And what they showed was that what leaders care about and typically base at least 80% of their messages to other people on does not tap into roughly 80% of the primary motivators of the workforce to put extra energy into the change program. So I think, you know, that's we should really reflect on that and think about framing. You know, how do we, as health and care radicals, frame our messages, get them across in ways that will really help people connect? So, you know, what's this about? You know, I've got some key performance indicators for you, or I have a dream. And I think, of course, we have to have key performance indicators. It's kind of part of our world. But I think if we can start with the dream and we can build community around the dream, it makes key performance indicators an awful lot easier to do, because people understand why we have the indicators. And somebody who I respect very much is a guy called Ron Weil, W-E-I-L. And he talks about sense making, and he says, you know, very often organisational leaders were asking our staff to be ready for change. You know, this change is going to happen, be prepared for it, you know, lots of things are going to change. But what we don't do is we don't engage our colleagues enough in sense making, okay? And sense making is something we've really got to be able to do very well as health and care radicals. And the thing about sense making is it isn't done by, you know, marketing, right? People say you've got to communicate 10 times for a message to be heard. This isn't about one-way communicating. It's not about slogans, but it's about how we make an emotional connection with employees and our colleagues. Interesting. So, you know, going back to the theme that we were talking about last week around the dominant approach and the emerging direction, and thinking about how the world of work is shifting. And, you know, starting off with the kind of dominant position and the hierarchy, that we see the organisation as a collective. So when leaders are putting messages across, or if we're the leaders, we're seeking to do it because we want to build the allegiance. You know, we want people who work in the organisation at all levels to buy into the goals, the culture and the ethos of what we're trying to achieve. And yet when we think about that emerging direction, you know, we talk about the network, it's about a connective, it brings people together. And here, actually something much deeper is going on. You know, it's about a work culture or a corporate culture or a community culture that is much deeper. It goes beyond the organisation, and the actual hierarchical structure needs to be subordinate to that. So I think, you know, when it comes to framing and storytelling, the world that we're being part of is going beyond organisational leaders who are able to get messages across effectively. Actually, it's about how, you know, we as leaders of change, whether we have formal authority or not, can actually, create messages and calls to action that connect much more deeply with people. So you see that the evidence is clear. And the slide hasn't come out properly here in the bottom bit. There should be a part in the bottom that says action. There's a cloud that says action, but it doesn't appear on my screen. So just imagine, okay, there's another little box at the bottom that says action. If we want people to take action, the most effective way of doing that is by connecting with emotion through values. So if we want to win people to action, we need to connect with emotion through values. So just thinking about this, you know, I think when I think back, when I went to improvement school in the NHS a very long time ago, I got taught that if I want to engage medical doctors in change, I have to show them a graph, okay? Because if you want to win a medic to be involved in a change process, they need to see the data, they need to see the evidence. And of course, statistics and data and evidence are really, really important, but you know, they're not enough. And even medical doctors are far more likely to be one to change because we connect with emotion and values than because of seeing some rational data. Although obviously, if we have a scenario where we've got some very compelling data and we can frame that with a call to action based on values and emotion, I think that's the best of all worlds. And then another piece of research that I found very interesting was this one by Deborah Small and partners, and this came out in 2007. And what it was about charitable organisations and the way in which they made calls for funding. And what they basically found was that however awful and appalling the statistics were about the situation, it was only when they actually started to tell stories about individual people and the things that were actually happening, the appalling things that were happening in their lives as victims, that people would donate. Okay, people wouldn't take action and donate money on the basis of high-level statistics, however awful the statistics were. People would only take action and donate money when it was about individual victims. And I think there's some really important learning in that for us as health and care radicals. And I'm just going to put I'm just going to put Jenny and Pip on standby, because after this next little bit, we're going to look at what's coming over on Twitter and the chat. So we're basically saying that what matters is about being able to make an emotional connection. But not all emotions are equal. There are some emotions that motivate people to take action, and there are other emotions that inhibit people from taking action. So what we need to be able to do as health and care radicals is to connect with and appeal to those emotions that motivate people to take action, and by that overcome the emotions that inhibit people taking action. I'm just going to stop here for a moment. In the chat, will you write down what you think are some of the emotions that motivate people to take action? Let's see if we can see some of those. What do you think in terms of, if we're trying to make an emotional appeal to motivate people, what do we think that some of these emotions are? And we're seeing a few coming here in the chat, which is great. So, frustration, anger. Jenny, what's just saying.
They're going so fast.
I know, that's great.
Passion, empathy, pride, compassion, anger.
Yeah, a lot of anger.
Lot of anger.
Yeah.
Hope.
Yeah.
Love.
Empathy.
Yeah.
That's interesting.
Service is a nice one.
Yeah. And what do we think are some of the emotions that inhibit people from taking action? So in a sense, the ones that we need to overcome.
Yeah. Oh. A tidal wave of fear.
Yeah.
Humiliation.
Yeah.
Come up a bit. Apathy.
Yeah.
Exhaustion. Pride.
Yeah.
Pride, that's interesting. Pomposity is a nice one.
These are great. Wow. Loss of control.
Helplessness and lack of power.
Yeah.
Yep.
You know, what's interesting to me is that fear appeared in both the lists, and I think it's an interesting question. So, generally, does fear motivate people, or does fear demotivate people? And I would say that in general, fear inhibits and demotivates. And certainly in my work, going into NHS organisations, I can almost smell how fearful a culture is. I know that sounds ridiculous, but I can. And what I see happening time and time again is organisations that are very oppressive and people are fearful. What you get a sense of is people not feeling safe to make change, not feeling safe to innovate, and people kind of being clamped down, battening down the hatches, not putting your head above the parapet. And I would agree with most of you that whilst fear might make people take the first few steps for change, when it comes for long-term sustainable change, I don't think that fear is a motivator. So let's just have a look at this little list here. So, and again, what I say about this, there's no right or wrong list, But what matters is that we're thinking about this very deliberately as change agents. So, you know, I'd say, how can we, as radicals, build a sense of urgency? You know, if we don't take action now, bad things will happen, to overcome inertia. How can we utilize anger? So one of the things that I was involved in was the call to action on antipsychotic drugs and people with dementia. And the more that I found out what the reality of that was for the lives of thousands of people with dementia, the angrier I got, very angry personally. And anger will help to overcome apathy. Hope, we have this one in our list, you know, a sense of hope, possibility, you know, helping people to feel more confident about moving to a different future, to overcome fear. And again, I think we absolutely have these, you know, a sense of solidarity. You know, we are in this together, how we build community to overcome isolation. And finally, a sense that every one of us can make a difference if we link up with other people to overcome self-doubt, you know, the lack of self-efficacy that we talked about last week. So I'm going to stop there. And I'm going to ask, first of all, I'm going to ask Jenny to tell us about what we're seeing on Twitter.
Thank you, Helen. Hello, everybody. The camera might swap to me in a minute, but if not, I'll just carry on anyway. So really, really interesting on Twitter, and this is kind of our third module, if you like, because we've done, we did module 1 twice, and then this is obviously module 2. And the Twitter has been really different each time. I think it's fascinating. So we started off with this notion that people need to create communities for themselves. And then actually on Twitter this morning, we've seen all 3 different sorts of communities that we talked about today. So we've talked about locality, and we've got people from North America and Scotland talking to one another on Twitter about how they get together and form a community. As a request on Twitter for an emergency care special interest group. So if there's anybody else on the call interested in that, then get yourselves over to SHCR chat. And then there's that general feeling just of the community spirit that just comes out loud and clear. And I want to just share a few quotes. One that's just come up, which I love. Stories are the data of the soul. Someone's put that on. And then someone's quoting Margaret Wheatley. There is no power for change greater than a community discovering what it cares about.
Yeah, that's great. And Pip, if you can attempt this task of trying to summarise what we're seeing on the chat box.
So there's been lots and lots going on in the chat box. I think the things that have stood out for me this time that have been a little bit different from last time is that there's really quite interesting debate and some excellent, challenging, thought-provoking comments. But the general themes are that people do need to have a vision of where they're going to go. Somebody said, I think, keep your eye on the prize, which is a lovely way of thinking about it. And, and definitely a theme that people do want to do the best they can. And so it's really a question of having the resources, both in terms of time and energy, to actually accomplish the dreams that they have. There are some lovely examples of people making good change and establishing communities. For example, I was struck by the Queen's Nursing Institute, which is a really wonderful radical organisation, and Helen's example of antipsychotic prescribing in dementia. Some fantastic examples of people building communities and making connections both geographically and kind of intellectually and emotionally. So please do keep the chat going. It's really fascinating to see your thoughts and your insights and to learn from you.
That's wonderful. Thank you both. So, carrying on with this theme about, how we're framing to connect with emotions and values and call people to action. So, what we're saying here is that as change agents, if you like, what we should be doing is to connect with these emotions that motivate people to take action. And I'd say that the most effective way, or one of the most effective ways of doing this, is by telling stories. And again, it's interesting. There's a lot of research data. One statistic is that where we actually tell a story, people that are hearing the story are 22 times more likely to retain the story than they are when they're shown statistics or data. So if we're going to, if we're going to frame, if we're going to connect with what matters to people, if we're going to motivate through positive emotions, then how would we do this? And I want to suggest a number of things that we ought to do. Okay, we do need to tell stories, and I would really recommend that you go into the study guide and think and kind of follow the little process through in the study guide around telling your own story. And it's really, really important that we make our stories, they're personal, that we don't, so if we're kind of trying to do change in our organisation or change for our community, we don't just talk about the story of the organisation or the story of the change. We actually make it personal. And a key reason for doing that is that when we tell our own stories, people hearing our stories will connect with our values. Many of us work for organisations that have got a value statement or a set of organisational values. And it's one thing to say, yes, the values of my organisation are compassion and empathy and so on, but that doesn't mean anything. But when I tell a story about me and something that happened in my life and other people hear that, they can connect with my values. It has to be authentic, it has to be real. Again, there was a lovely resource in the study guide for Module 1 about vulnerability and modelling vulnerability. And if we're prepared to tell our own stories and model that vulnerability, then people will really connect with it, and it will help to call people to action. But we're not just telling stories for the sake of stories and getting people to connect with us. What we're trying to do is seeking to do is to create a sense of us. So in a sense, by me telling my story, as a change agent, what I'm hoping it will do is that it will help you connect with my story and maybe tell your own story. And by all of us telling our stories together, we can create a sense of what unites us. And we need to be clear who the us is. And when we talk about that, it's like who do I want to be part of my community? Who do I want to connect with? Whose story do I want to hear? And even little things like people that I've worked with for 20 years. We've often never told each other stories before. And then we start a new project and we just go around and get people to tell their stories at the beginning of a project. And just the difference it makes in terms of how we connect with each other is really important. So what we also want to do is we want to use, in a sense, our own stories, connecting with each other through the stories we tell to build in a call for action. So if we're trying to make a difference, then connect our stories to the action that we're trying to take. And one of the other resources that we're suggesting is the Patient Voices website, which is full of the most wonderful stories. So, really recommend you to go and look at the Patient Voices website. So I can't just sort of sit here and say this is what we need to do without role modelling it. So that's what I'm going to seek to do now. So what I'd like to tell you about is why the School for Health and Care Radicals is important for me by telling you a little bit of my story. Here we go. This is me. I'm 18 years old and I'm a student of social science in Manchester. And I love social science. I love learning about people and systems and what makes them tick. And I'm full of fervour and passion and wanting to change the world. And I believe that everybody's got a right to education. Everybody's got right to healthcare. And I'm active in my community and in community development projects. I work with a whole series of elder people, and I have a lady that I visit in her own home, and I feel like really angry that she's alone, she's not being looked after by other people, and I can't kind of think at 18 years old what it must be like to be 80, but I think that we, as a community, we should be looking after people better. So I am active. I do believe, I'm idealistic. I think that if people come together and we build community and we do things together, that we can really make a difference. So here I am at 18, and I want to show you me at 22. And my question is, what happened? And the reality was that I stopped being a student and I went into the world of work. And I think that, what work does to us very often, we get into a corporate culture, and even though we think, well, I'm in an organisation and I'm a public servant and I can really make a difference to a lot of people through the work that I do, it seems to me that it's almost like these tentacles of organisational, what would you call it? Conformity. It kind of gets to you, and it kind of got to me, and I got into organisational life, and I accepted the norms. And like when I think back now to the School for Health and Care Radicals, I really feel connected to that 18-year-old, because actually I think that's the real me. The person who feels a real sense of mission in life, who's willing to do active things to make a difference, who thinks that actually the biggest power is in community and not necessarily through corporate life. And that's why I'm kind of really proud now to be part of the School for Health and Care Radicals, because I think if all of us can connect back with the people that we started out with, as the people with a true mission in life, then I think we really can make some great change happen. So what I'd say to you is, what's your story? Okay, and again, follow this through in the workbook, in the study guide. Okay, when you think about your story, what are some of the challenges that you face? What was the challenge in the context? What choices did you make, and why did you make those choices? And what was the outcome of your story? And I think that if we can tell stories where we're showing very vivid detail, we can talk about specific challenges, specific moments, who some of the people were, our values, then I think that through stories, as change agents, we can really make a difference. Just I'm going to pause there for a moment. So I said that we need to tell our own stories, that we need to make them personal, and they need to be authentic. But the next thing we need to think about is, how do we use our stories to create a sense of us, to build momentum for change? And I think there are some important issues here. And again, going back to module number 1, and we looked at this research from these Canadian researchers who said here, if we want to create small-scale change, we should do so through a cohesive network of people like us. But actually, if we want to create some big change, we need to create bridging networks between groups that are currently disconnected. So, how big do we want our us to be? Do we want our us to be a small number of people who are like us and create small-scale change? Or do we want to think about how we create very large-scale change? And if we look, on the evidence base in the literature, the way that this gets talked about is about strong ties versus weak ties. And I think that these are very important ideas, concepts for change agents. And if you like, strong ties are about the kind of change that cohesive groups bring about, and weak ties create the opportunity of working through disconnected groups. So let's think about this. In health and care, most of the change that we see is spread through strong ties. And when we talk about a strong tie, we mean people like us, so cohesive groups. And I'd say in the NHS and in social care, most change happens through strong ties. Okay? We interact with people who are like us, who had a similar life experience, a similar educational background, similar beliefs and values. And what it means is that when we do change through strong ties, it's peer-to-peer. So it's GP to GP, you know, emergency nurse to emergency nurse, gynecologist to gynecologist, or whatever. And we spread influence through people who are strongly connected, who like each other, and who trust each other. And guess what? Spreading change through strong ties works because people are far more likely to be influenced or to adopt new behaviours or to adopt change or new ways of working from those with whom they are most strongly tied. And you know, for the first kind of 20 years that I worked in healthcare improvement in the National Health Service in England, I did so through strong ties. And the kind of theory, the idea of change in my head was that, you know, we need to, you know, if I want to influence a group of GPs, I need to find another GP to go and influence them because I can't influence GPs directly. So let's talk about this a moment. Let's think about, you know, as change agents, as radicals, creating change through strong ties. So first of all, can we talk about what are some of the benefits of creating change, spreading change, building a network of people like us? So what are some of the pros, the advantages of leading change through strong ties? Can we put some things in the box? So what kinds of things are we getting? Pip and Jenny, do you want to tell us about it?
Trust, energy, cohesion, shared language, encouragement, like-minded people, shared visions.
Knowing what people value, trust,
yeah.
Learning, lots of learning in there, learning from each other, each other's mistakes.
And what are some of the issues about, or the problems, or the drawbacks of creating change through strong ties? Can we put those in the box now?
Groupthink.
Yeah.
Shared blind spot.
Being outside the NHS.
I know you can't. When you're outside the NHS, it's very hard when the NHS is working through strong ties.
Yeah. Same old, same old.
Closed communities.
Yeah.
Yes. Could exclude others, us against the world.
Yeah. Okay.
Old boy network.
Yeah.
Complacency. Yes.
Yeah. Great. Faith when people. Yeah, these are great. So actually, what we're saying as a kind of community together on this webinar this morning is that whilst there are lots of advantages in creating change through a strong tie peer-to-peer approach, okay, it has its very definite limitations. And in a sense, change can only go so far because there's groupthink, there's conformity, there's lack of diversity. And you know, a kind of big theme around the school, which is that it's about, you know, thinking for the emerging direction of change and thinking about being a change leader in the new era. You know, what I would say is that weak ties, okay, or it's much easier to create weak ties in a scenario when we've got a lot of access to social media. So let's think about this. Okay, so the first box here on the left was what we were saying about strong ties. And then here, you know, what happens when we work through weak ties, okay? We can build bridges between groups and individuals who were previously different and separate. But, you know, it's like some of the discussion that was going on in the chat box this morning, that when we work through weak ties, we build relationships with each other, not because we're like very similar to each other already, but because we've got a common purpose, common interests, and common commitments. And our aim when we work through weak ties is how can we mobilise all the resources, all the people that can potentially help in our organisation, our system, or in our community. So, you know, so the social era, social media, creates lots of opportunities of working through weak ties. And again, you know, going back to that Canadian research, this is really important because we're only going to create big change when we can actually build bridges between different disconnected groups. And, you know, of course, there are advantages from working peer-to-peer, and we should continue doing that. But actually working through weak ties is a really effective, or it can be a really effective change strategy. Okay. First of all, like many of us said here, weak ties are much more likely to lead to change at scale because there aren't boundaries like there are with strong ties. And with strong ties, change can only go so far in terms of the community of people that are similar. Secondly, when things are very uncertain and resources are very short, like they are in health and care at the moment, what we tend to do is, because we're fearful, we revert back to our strong tie relationships. And we can really see that happening in the NHS at the moment, you know, that we're uncertain, we're fearful, so we stick with what we know and the people that we trust. However, history shows us that when it comes to searching out resources in times of scarcity, like now, weak ties are much more important, because by having diversity of thought and diversity of experience and lots of new ideas coming in, then we're likely to come up with much more innovative ideas. Our most breakthrough innovations will come when we tap into our weak ties. And, you know, I think that part of the opportunity that we've got with the school is around weak ties. And history tells us, okay, that actually if we want to create big change and big improvements for lots of patients and lots of service users, then we need to focus on weak ties as well as strong ties. And let's go back to, to asking about the great social movement leaders and how did they work with weak ties. And I mean, this comes from Benford and Snow, and again, when we look at the social movement literature, one of the kind of big themes in recent years is about master framing. So we talked about framing and the way in which, we're going to put on construct our message to call people to action. And what a lot of the literature talks about is about master framing. And in a sense, when we think about the great social movement leaders, what they were able to do was to frame their change proposition in a way so that it didn't appeal just to a small group of people with strong ties, but to a much wider group of people with weak ties. So in a sense, the great social movement leaders were able to work very effectively with weak ties. And again, it's really interesting to look into some of the literature, for instance, when we look at the American Civil Rights Movement, okay? The American Civil Rights Movement and the leaders of it didn't just work with the obvious strong ties. So, groups of African Americans in the southern states who were, massively oppressed, what they did, the American Civil Rights Movement leaders, very effectively was to work with weak ties, to send messages out and frame and call to action people across the whole of the country and the whole of US society to play their part in putting right a terrible wrong. And again, when we look at those leaders and the way in which they were able to build and unite people around weak ties, what we see that they did time and time again is three different things. The first aspect was in their framing, it was diagnostic. So what they were able to do, and it's right back at the beginning when we talked about what do effective groups and people do in effective social movements, okay? They build understanding. And the first is diagnostic, in the sense that people understand the problem. What's the nature of the problem we're trying to address here? What's the extent of it? Like, who's the enemy that we're all uniting against? The second aspect is prognostic, looking forward. What is the different future that we're trying to create? And in terms of moving towards that future, what's our plan of attack? What are the actions that we're going to collectively take to get there? And what's our strategy for carrying out the plan? And then the third aspect goes back to what we've been talking about, storytelling, about framing that makes an emotional and value-driven connection. Why is it urgent that we take action now, that we all stand up and take the action we need to take? Okay? What's our call to action that connects with the motivational and emotional drivers of our audience? Okay? So just reflecting on those three components, if you like, of master framing, when we think about most of the change initiatives that we see in health and social care, okay, within the system, when we think about the way that often as leaders we put across our messages, which of these three do you think is the most dominant? Okay, because there's one that I think is very dominant. And do you want to put it in the box? Which one of these three, when you think about when you think about initiatives in the NHS for cost and quality improvement, okay, which of these three is dominant as a message? Yeah, Deborah's got it. Actually, what we see time and time again when I think about cost and quality initiatives, it's almost exclusively diagnostic. You know, we have to take £27 million out of our budget by the 31st of March. And even, you know, when we think about things that are very quality driven, so we think about compassion, okay, very often we're talking about the compassion gap and not where we want to take things. And I think that it's just so helpful thinking about our messages in this way. So, you know, to combine, you know, great analysis with stories and getting messages across that include all three. We're nearly there. Okay, just, one thing I wanted to say, we talked a little bit, you know, at the beginning when we looked at that model of where, you know, the current situation and the emerging direction. And one of the things that we talked about was moving from transaction to relationship. And what I'd say is that if we're going to work as leaders of health and social care and as change agents in health and social care, and we want to start working on this basis with relationships rather than transactions, we have to follow through. And once we start working at this much deeper level, which is about values and emotions and commitments and trust, we can't like do that one day and then go back to the old performance management system the next. And I think the way that Nilofer Merchant puts it over here, you know, if people give to a cause, and in a sense, by mobilising them, that's what we're asking them to do, they expect to have a relationship, not a transaction. I'll just tell you a little story about this. I was involved in some research a few years ago, and it was about senior clinicians who used to be skeptics about quality improvement, who became champions of quality improvement, and it was a qualitative research, and it said what made the difference between somebody being a skeptic and somebody being a champion, and it was kind of interesting about these factors, you know, what moves somebody. But the most interesting thing was that in doing this research, the researchers who worked with us, they found a subpopulation, and the subpopulation were clinical leaders who used to be skeptics, who then, like, you know, were mobilised and their expectation raised about being a champion of quality improvement, but then the relationship wasn't continued and expectations weren't met. So they went back to being skeptics again. And what the researchers found was that the clinical leaders who were skeptics who became champions and then became skeptics again were far more skeptical than the people that were just skeptical in the first place. So, you know, once we start working with these methods, we have to follow it through. And I really like this quote that comes from Benjamin Zander, who was the conductor of the Boston Philharmonic Orchestra. And he says, "A cynic, after all, is a passionate person who doesn't want to be disappointed again." And I think that there are a lot of those kind of cynics in health and care. So what I was going to do is quickly hand back over to Liz. And you know, just to say, in the context of this, just thinking about who are our communities, you know, who are we connecting with as leaders of change, and where are some of the opportunities for us to influence. So, Liz, back over to you.
Thanks, Helen. It's nice to talk to everybody again. And I'm going to put Sue and Jodie, my panellists, on standby because I'll be calling you in a minute. So just before I bring the girls back in then, I'm just thinking back to the earlier slide about action inhibitors and the overwhelming comments in chat around fear. And somebody actually put a comment in chat saying that we underestimate how hard it is out there. And I guess that's one of the reasons why, for me, these connections are so important, because it's through the collective that we're enabled to actually make change, and it's what gives us the power. And it was no mistake that when Helen and I did that work with Paul Bates and others, that we called the book The Power of One, The Power of Many, because we get our strength from each other, and that's how it all happens. So I've got these questions that I put to the girls. We talked earlier about why it mattered to them to form as a group and come together. But Sue, I'm going to ask you just to talk for a little about how are you actually forming and what do you actually plan to do? What is it you're actually going to do? And how do you feel that being part of this community will help you as a radical? And while Sue's talking, I'm going to ask Kirsty and Carol, both of whom we had sound problems with this, if they could put their comments around these questions as well in the chat box. So over to you, Sue.
Okay, I think how we're going to move forward, it's in two ways. As I said earlier, we've got interest from the wider West Midlands for people to form a group, and we're actually discussing what will that look like and what will that mean. But internally in the organisation that I work in, people have come together and have said they want a support group. They want somewhere where they can feel safe, and if they feel that they're going to be implementing change and have some results towards that change, they want this support group to be a sounding board and a peer review group, and somewhere where they can discuss how can I move forward, which is really great. They've agreed that they're going to set up what they're calling a walk and talk, and this is a walking group who will use that time to reflect on the modules and the questions that you pose at the end of the modules for reflection, so that they can then think about how they can start building on that and working through what they can do collectively within the organisation to make some change. They've also asked for a conference call on a regular basis so that we can all get together and discuss how we're getting on, what sorts of things are affecting us, and what have we learnt through the reflections on the modules. They've all signed up to be ambassadors for the school and ambassadors for Change Day, and they're committed to next week to going onto NHS Change website, looking at pledges that resonate with them, and then they're going to send those around the organisation. And in my role as head of leadership, we've got an open day next week for the whole organisation, and we've got a pledge board up, so we're encouraging people to put their pledges on as well. So I think in a week, that's absolutely fantastic.
I think in a week that's absolutely amazing. But talk about an example of coordinated activity. So, you know, you can hear purpose in it, you can hear intentionality in it, and, you know, it's not just, you know, a lovely notion of coming together and just all having a great time. It's very, very intentional, all of which are really critical. I was in the RIS as well, Belinda, by the way, after seeing your post on chat. I agree, that's exactly what we used to say. So really, really important, this whole notion of coordinated activity. So Jodie, I can see you're on mute. Can you come, oh, there you are. Jodie, do you want to give us some thoughts about what you've been doing?
Thanks, Liz. Wow, Sue, I don't really know how to follow that. That's mighty impressive. I don't know if this will be reassuring to some other people out there, but we're not nearly as coordinated as Sue's efforts. For me, I'm going to try to take this forward now and model it on the way in which this whole School for Health and Care Radicals has been organised. I have a lot of admiration for the people that have put this together and the way in which you can interact in so many different ways. And I would like to kind of set up a mini model of that, but within my radical community that we're going to take forward. So we need to have multiple channels of communication, be it you know, a daily email that connects us through a quote or a question, Twitter chat. I'd also like to set up some kind of internet portal, some forum where we can sit and have live chats together, kind of in a closed network, to give a little bit more security. But it's really interesting because just being on this module today, Pollyanna's come in, the great network that Pollyanna is, and reminded me that of course there are already networks out there, and let's not try to recreate the wheel because there's people already working in the role of hubbies for NHS Change Day. So as a result of that, I'm going to come off this module later on and connect with my regional hubbies to make sure that I'm not trying to kind of duplicate effort that's already going on out there, so we can build on that momentum.
That's great. Thanks very much indeed, Jodie. And what's really striking for me about everything that you've just described is the really significant role we have now that technology plays in actually helping us to achieve this. Whilst I've been monitoring the chat and listening to Helen as well, I've noticed people from, we have people from all over the world talking to each other and connecting with each other. And so whilst we have our locality groups, our virtual groups are going to be critical as well. So just before we finish this last little interaction, I'm going to come back to you, Sue, just for some reflections about that you have on forming communities that you can share with the group. Obviously, you've done some tremendous, very practical and tangible things, but reflecting back on the last week, what can you share with us?
I'm finding it hard to say, actually, because although all these activities happened, I've actually been on annual leave this week, so it's amazing that they've formed all this without me physically being there. I just think it's just been an amazing journey in that these individuals feel that they've got this community, and I honestly think it all goes back to belonging. For me, it's about bringing people together so they've got that sense that they belong and that they're not isolated. I think that's the most important thing for me.
That's great, thank you, Sue. And what's really interesting for me about this is Kirsty has been putting comments in the chat because she's got problems with her microphone, and she talks about the power of the diversity of her group and how they've been having email conversations together. And Kirsty's on maternity leave. Sue's on annual leave. The amount of discretionary time that we're seeing here that people are bringing to this is quite extraordinary to me. And there's all sorts of research around discretionary effort, but it's a really, really important thing that we mustn't lose from this. Jodie, some final reflections from you on forming communities that you'd like to share with the group.
I think the key message for me is to not believe the kind of self-propaganda that goes on in your head all the time, that people won't necessarily want to be involved or people will be afraid of being involved. I suppose I've been a little bit cautious purely because of personal experiences recently at work and in the organisation, and I've been a little bit reticent about coming forward with this. But it's amazing that now that I have started to make moves, the number of people that are coming to me and thanking me for speaking out and making a move on this, on taking something forward. So I suppose, yeah, just to summarise that, it's about don't make up other people's minds for them before you've asked them.
That's great, thanks, Jodie, and you really bring to mind, and I'll put this in the chat as well, a great book called The Chimp Paradox, The Mind Management, and it's all around all that self-talk. It's by Dr. Steve Peters, so I'll type that up. So I'm going to hand back to you now, Helen. I really want to thank our panellists. Thank you for the silent but chatty ones in the chat box, and particularly thanks to Sue and to Jodie. So back to you, Helen.
Thanks, Liz. That was great, and I mean, it's just so inspiring to hear Sue and Jodie and all the other comments in the box as well. Fantastic. And so we're coming to the end of our session now. So what I want to do is I want to hand over to Jackie, who's our chair, just to do some reflections, and then I'm going to put Pip and Jenny on standby to give us a very quick overview of Twitter and chat. So Jackie, reflections.
Okay, thank you. And what another powerful session that we had for Module 2. I think my kind of big reflections were what everybody was saying was this sense of belonging, and how we create the us and us. And I think the second thing for me was how do we put our messages across as health and social care radicals, and how important that is in terms of how people will join us in how we use those messages. I think the next sort of key reflection was this really powerful way of framing and how compelling that needs to be as a radical, and how important that is for us as health and care radicals to do that. I think that the most powerful one, though, for me today was this we've talked a lot about sort of creating kind of mass communities and, you know, collectively joining together with, you know, bigger and wider networks. But I saw in the chat many people who were actually saying how they were struggling with just influencing their chief executive or influencing the immediate people around them. So it's how do we kind of start small and then bring this kind of whole sense of community and belonging, which I thought was probably the most powerful thing in the whole session for me as a reflection. And I thought what really brought it together was those fantastic examples right at the end of the so many people who said actually the simple steps that they're going to take when they leave the webinar today. So fantastic chat, fantastic presentation. I'd just like to thank everybody, and I now want to call you to action in terms of the next slide that's gone up. I'd really like to invite you to go to the campaign page if you use the link that's on the slide there, and we've just reflected 3 pledges. You can use one of these 3 pledges, or you can make your own pledge based on the conversation that we've had today. So how can you identify which community you might be part of, and how can you utilize those existing communities for change? How might you be able to reflect on those who'd like to be a part of your community for change, and how you will connect with them? And also creating your own narrative. I think this is so important so that you can win others to your cause. So those are just 3 campaign pledges that you could add to the campaign page. If you use that link direct, you'll see the School for Health and Care Radicals community on there. I'd like to thank Helen, and I'd like to thank everybody who's taken part so far. I'm now going to ask Jenny if she'd just give us a very short reflection, and then we're going to hand you over to Pip. Thank you.
Okay, thank you. So I'm just going to give 3 things really quickly, a reaction, a challenge, and a reminder to us all. So Helen's loads and loads of reaction on Twitter to the notion of weak and strong ties, and people really seize the idea of the weak tie idea and really look like they're going to go away and try to exploit that. A challenge from Maxine Craig, who's been very active on Twitter and chat, so she's a super multitasker. How do we get elders in the last part of their career to connect to their 18-year-old self, which I think is a fantastic challenge. And then my final thing is just that little reminder of remember to listen as well as tell your story. Thank you.
Great advice, brilliant.
So just to reiterate what's been happening in the chat box, I think the thing that stands out for me, I just underlined the word that I wrote down most often, and it was to do with connections, connectedness, and a little bit about disconnected. And somebody had said, radicals bring together disconnected groups, which I thought was a lovely idea, and that linked really well with somebody else who talked about using diversity to find new opportunities for change. So I think those are both really good thoughts about building up weak ties. And I think for me also what really sums up all of that is E.M. Forster's quote about only connect. She says only connects the prose and the poetry, and both will be exalted. So just to remind you that the learning doesn't stop here. Please join us on Sunday evening with a conference call, and we'll discuss actually Module 2, I think, although it says Module 1. So we'd love to share your experiences. Next Wednesday, there will be a tweet chat, so please do tweet your ideas, reflections, suggestions, experiences at the hashtag you can see on the slide. And then next Friday morning, do join us again for Module 3, which will be about rolling with resistance. And in the meantime, we do urge you to take a look at the study guide. There are plenty of opportunities for you to reflect and think about your learning. Do consider keeping a learning journal. I think a couple of people have said they're busy writing down their reflections and inspirations from this session, but really give some specific thought to what learning and inspiration you can take from the social movement leaders that we've talked about today and other ones that you may be familiar with. How are you going to attract the attention of the people that you want to call to action, both those strong and weak ties? And who are the people that you're currently disconnected to that you would like to make connections with in order to achieve your own goals? So how can you actually join up with them and make an us out of the you and the them? So thank you very much for your time, your suggestions, your enthusiasm. We look forward to seeing many of you next week. Have wonderful weeks, and goodbye to everyone.
Bye.
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 Bye-bye.